So I'd like to tell you the story of a woman I saw recently in the office. She was a 55-year-old woman. She had been happily married for 25 years to her husband. She had, at this point, 2 grown children. So they were like empty nesters and they were loving this season of their life. She worked from home. So she was looking forward to having more time finally to herself, to the things that she enjoyed, as well as to her husband, who she loved dearly. And, in the last year or two, she started to notice on and off, she would have these symptoms of, vaginal burning, irritation or burning in the labial area down below, vaginal dryness, and vaginal itching and irritation. She just didn't, but then ultimately over time, she started to notice these things were happening more frequently than not. And then she started to have additional symptoms like painful intercourse, vaginal burning, and urinary urgency. Urinary burning, when she peed, it would burn. She was starting to get infections, urinary tract infections more frequently, and there was this vaginal odor she could not get rid of. She saw doctors and they did several vaginal cultures and urine cultures, and it all came back negative. And she had no answers. She was uncomfortable. She was frustrated and she wanted answers. So she found me and she then came to see me, consulted with me, and to a surprise, I diagnosed her with a condition called GSM, or Genitourinary Syndrome of Menopause. GSM, Genital Urinary Syndrome of Menopause, is a condition that affects many, many women in menopause and perimenopause. It is quite common. Not many women know about it. Also, not just as women get older, but women who've had different conditions like surgery, women who've had cancer-related treatments, women on certain medications, women who smoke, and even women after they've had children. When a women's hormones are lower, some women may feel some of the symptoms that women in menopause experience. It is caused by different things. And women feel these symptoms around the vagina, the clitoris, the urethra, and the bladder. However, thankfully, there are good and safe and effective solutions available nowadays for women in menopause and perimenopause that can improve a woman's quality of life, comfort, and confidence. And so in this video, we're going to talk about GSM, what it entails, and actually how to get it better. So GSM, or Genitourinary Syndrome of Menopause, comprises of many symptoms like vaginal dryness, vaginal burning, irritation, itching, painful intercourse, particularly upon insertion. Some women will notice, less arousal, less sensitivity, less lubrication with intercourse, urgency, frequency, or more bladder infections. It is very common in women in menopause, but it can actually start perimenopause when a woman's hormone levels start to decline, a woman's pH and vaginal pH starts to change when there's not enough estrogen, progesterone, and testosterone in a woman's body. Women can then start to note, and things we see on an exam is like thinning of the vaginal walls. Some women may notice some drooping of the labia, or it may become asymmetric or not as plump. Some loss of vaginal moisture, elasticity. Some women may actually experience some narrowing of the vagina, and it is something that affects many, many women. Some women will also notice that they don't have as much lubrication. The pH of the vagina changes, and so that can also affect the normal bacterial balance in the vagina. And so some women may start to get more yeast infections with intercourse, vaginal bleeding, tearing, inflammation, in fact, even loss of support. So some women are at more risk for prolapse or urinary incontinence, or just feeling as if you have a bladder infection, but truly there's no infection because the urine culture is done and there's nothing in there, all because of less hormones. And so when we evaluate a woman in the office, of course, we do a thorough history. We see how this is impacting a woman's quality of life. And we do a physical exam, pelvic floor exam. Of course, we want to rule out that there's no bladder infection, make sure there's no vaginitis. And that's part of what we do in the office to determine what this is. And when those things are negative, then it could be GSM. The way it's treated is, first of all, we can do what we call vaginal moisturizers. So the treatments that are available, again, we start with, as a review, it could be vaginal moisturizers or vaginal lubricants. Those aren't effective enough, then we go into like hormone treatments, either as a cream, a ring, a gel, a tablet taken orally or inserted vaginally to help alleviate symptoms. And if a woman needs more help above and beyond that option, then there are more procedural options like laser treatment and collagen injections or surgery to help to reestablish the symmetry to the vagina and the labia and increase the strength of the walls to help with alleviating particularly symptoms of vaginal sagging and loss of sensitivity with intercourse. Again, there are many safe and effective solutions. If you're a woman listening to me right now, know that GSM, or Genital Urinary Syndrome of Menopause, is a common condition that significantly impacts the quality of life of many women in menopause and menopause. However, there are good, safe, and effective solutions. So initial treatments oftentimes involve vaginal moisturizers. These can be used every day as often. They're water-based typically, and they help with vaginal dryness. Then there are also vaginal lubricants that are used during intimacy. They could be water-based, silicone-based, or oil-based, and this can help with making intercourse or intimacy more comfortable. The water-based lubricants are oftentimes made with hyaluronic acid. An example of an oil-based lubricant is like coconut oil, almond oil. Those can be used for intimacy, and that can help things be more comfortable. If those things are not helpful, then a lot of them will try more hormonal treatments, either a vaginal estrogen or hormone cream. It can be given as a tablet, as a ring, as a suppository. There are oral hormone treatments that can be used that can alleviate vaginal dryness and GSM symptoms. Some women may use vaginal testosterone, and some women may use vaginal DHEA, which is a hormone converted to estrogen and testosterone that can help alleviate symptoms of GSM. When the hormonal treatments aren't enough to alleviate those symptoms, then we go on to some women will consider more procedural options. So on physical exam, we can see thinning of the vaginal walls, thinning, drooping, or asymmetry in the woman's labia, vaginal labia. There's loss of the normal folds in the vagina, loss of elasticity in the vagina, and some women may actually notice some shortening or narrowing of the vaginal canal, and that's what can make intercourse or intimacy more uncomfortable during menopause. Could be less lubrication or in the vaginal area, and also because of the change in the pH due to reduction of the hormones, that can cause change in the bacterial balance in the vagina. Some women may also notice more, maybe with intercourse, some vaginal bleeding, tearing because of lack of elasticity, inflammation. It just feels uncomfortable, burning, and some women are at risk, whether it's prolapse, bladder leakage, or just generalized discomfort or irritation in the vaginal area. On physical exam, we do a complete physical exam, see how this is affecting a woman's quality of life. We also check a woman's pelvic floor, and we want to rule out that all these symptoms are not due to a vaginal infection and, of course, a urinary tract infection or bladder infection. Once we rule that out and we ruled out those two things generally, then and a woman fits the category, then we say, okay, this is due to GSM. And if you're a woman listening to me right now with all of these symptoms that I've mentioned, know that you don't have to live or put up with it. They're good, safe, and effective solutions right now to help improve a woman's quality of life, comfort, and confidence. And thankfully, there were actually recent guidelines that came out to guide treatment for GSM, and I'm going to go through some of those treatment options right now. So initial treatments oftentimes involve vaginal moisturizers. These can be used every day as often. They're water-based typically, and they help with vaginal dryness. Then there are also vaginal lubricants that are used during intimacy. They could be water-based, silicone-based, or oil-based. And this can help with making intercourse or intimacy more comfortable. The water-based lubricants are oftentimes made with hyaluronic acid. An example of an oil-based lubricant is like coconut oil, almond oil. Those can be used for intimacy, and that can help things be more comfortable. If those things are not helpful, then a lot of them will try more hormonal treatments, either a vaginal estrogen or hormone cream. It can be given as a tablet, as a ring, as a suppository. There are oral hormone treatments that can be used that can alleviate vaginal dryness and GSM symptoms. Some women may use vaginal testosterone, and some women may use vaginal DHEA, which is a hormone that's converted to estrogen and testosterone that can help alleviate symptoms of GSM. When the hormonal treatments aren't enough to alleviate those symptoms, then we go on to some women will consider more procedural options. And those procedural options are like a vaginal laser that can be used in the vagina, and some are designed for the labia to help to increase the moisture, collagen, strength to the labia and the vagina. There's collagen injections that can be used and to inject into the urethra to help to support a woman's urethra to help with leakage. And then there are procedures that can help to provide support to the vagina, like a rejuvenation procedure if the vaginal walls are sagging, if the labia are droopy or enlarged or thinning. Surgery can be used to actually provide that symmetry to the vagina and help with the integrity or strength of the vagina as well. So Genitourinary Syndrome of Menopause, also called GSM, affects many women in perimenopause and menopause. It also affects women who go into menopause prematurely, not due to age, but maybe due to surgery, hysterectomy, not a partial, but a complete hysterectomy, cancer-related treatments, medications, smoking, and even women after having a baby may notice their hormones drop, and they may actually have some GSM symptoms too. It used to be called vulvovaginal atrophy, urogenital atrophy, or atrophic vaginitis, and is caused by age-related changes to the labia, the clitoris, the introitus, vestibule, the vagina, urethra, bladder, all those areas down below, in between the legs. Yes, it can cause those symptoms. And if you are a woman listening to me right now, you've noticed some of the symptoms that I've mentioned, and you suspect you may have GSM, know that you don't have to live with it or put up with it. I've been a urogynecologist for 20 years, and I've cared for 1,000 women like you with GSM symptoms successfully and safely, and I invite you to work with me. There's two ways you can reach me. me is through my website. It's www.drtugbiyele.com, or you can reach me at my office number. That's 470-325-1280. There's an inquiry form at my website that you can fill out. That'll get to my team, and they will help make an appointment and a consultation to meet me. Imagine how you feel once you've gotten to the bottom of what's been bothering you, and you feel more comfortable. You've gotten the treatment for your GSM symptoms. You feel more comfortable, confident, and your quality of life is improved. Yes, that is all possible for you when you work with me, and I'll see you in the next video.